You're probably really worried about the new COVID-19 coronavirus, especially if there are confirmed cases near you. Fortunately, you can take action to protect yourself and your family from contracting the infection. Simple things like staying home whenever possible, avoiding sick people, washing your hands often, and disinfecting high-touch surfaces can help you stay well. If you suspect you may be sick, call your doctor or your local health department immediately. Then, stay home until they tell you to seek medical care. Just follow these steps to protecting yourself against coronavirus. Number 1. Wash your hands with soap and water to minimize your infection risk. The best way to prevent coronavirus is to wash your hands as often as possible. Wet your hands with warm water, then apply a mild soap. Work the soap into a lather for 20 to 30 seconds, then rinse your hands clean under warm running water. This is about how long it takes to sing the "Happy Birthday" song to yourself twice. 2. The World Health Organization recommends not just rubbing your hands palm to palm, but interlacing and interlocking your fingers in a variety of different ways to make sure every surface is clean. Use the paper towel you dry your hands off with to turn off the faucet. 3. Always wash your hands before you eat or drink anything. However, it's also best to wash your hands anytime you're out in public or after you're around someone you suspect may be sick. If you can't wash your hands, use a hand sanitizer that contains 60 to 95% alcohol. Alcohol percentages higher than 95% are actually less effective. Number 2. Keep your hands away from your eyes, nose, and mouth. You may come into contact with the coronavirus on a surface, like a doorknob or countertop. When this happens, the germs can linger on your hands, so you can easily infect yourself if you touch your face with dirty hands. Avoid touching your eyes, nose, and mouth in case the virus is on your skin. 5. If you need to touch your face, wash your hands first so you're less likely to infect yourself. Number 3. Stay away from people who are coughing or sneezing. Since coronavirus is a respiratory infection, coughing and sneezing are common symptoms. Additionally, coughing and sneezing both release the virus into the air, so they may increase your risk of infection. Keep your distance from people who appear to have symptoms of an upper respiratory infection. 6. If it's appropriate, ask the person to stay away from you. You could say, "I noticed you were coughing. I hope you feel better soon, but please keep your distance so I don't get sick." If you know someone has been around sick people, it's a good idea to distance yourself from them, too. Number 4. Don't shake hands with people, whether they show symptoms or not. Unfortunately, people who are infected with coronavirus may spread the illness even if they aren't showing symptoms. 7. To protect yourself, limit your contact with others just in case. Kindly decline to shake hands until the coronavirus threat is over. 8. You might say, "I'm happy to meet you. Normally I'd shake your hand, but the CDC recommends limiting personal contact right now to help prevent the spread of coronavirus." Number 5. Disinfect high-touch surfaces daily using a product that kills viruses. Unfortunately, coronavirus can linger on surfaces, such as doorknobs, countertops, and faucets. Use a spray disinfectant or bleach wipes to clean these surfaces daily. Make sure the surface stays wet for about 10 minutes so it effectively kills the virus. This limits the risk of the virus lingering on the surfaces and potentially causing an infection. 9. In your home, disinfect your front door knob, kitchen counters, bathroom counters, and faucets. At work, clean surfaces that people tend to touch, such as doorknobs, stair railings, tables, and surface counters. You can also make disinfectant by mixing 1 cup 240 milliliters of bleach with 1 gallon 3.8 L of warm water. Number 6. Try not to worry too much if you're not truly at risk. Myths about coronavirus have spread on social media, sometimes causing unnecessary fear. Get the facts about coronavirus from a reliable source like the Center for Disease Control and Prevention (CDC) or the World Health Organization (WHO). Additionally, it's helpful to fact-check your sources before making any decisions. 10. While this new strain of coronavirus originated in China, it is not connected to Asian people. Don't treat someone differently or distance yourself from someone because they are Asian. Treat everyone with kindness and remember that anyone can get infected. According to the WHO, you cannot get coronavirus from mail or products that originated in China. The WHO also denies that there are specific foods that prevent coronavirus.